based purely on deaths of children. Let's look across the board. What are the symptoms? What is the person experiencing? Are they hearing voices? Are there emotional problems, mental, physical, behavioural? Has a medical psychiatric diagnosis been given? And within the realms of clinical psychology, has a psychometric test been conducted? Questioning particular boxes. So that's your baseline data. Then the intervention. What kind of intervention are we dealing with here? Which particular interventionist? What is their orientation? What is their training? What is their practice? Is it medical, psychiatric? Are they using drugs? Is it psychodynamic? Is it cognitive behavioural therapy, rational and emotive therapy, mindfulness, hypnotherapy, NLP? Any number of therapeutic approaches can be used effectively. And the post-intervention outcome. What is the result of the intervention? Did it work? How many sessions did it take? Has it contributed to a better quality of life? How do you measure that? Simple, really. You just say to the patient, are you still hearing voices? How are you feeling? It's like, have you taken control of your life? Is it better? It's not a difficult thing to measure. The clinical psychologist will use a psychometric second measure. So, who should participate in such a project? Therapy clinics, independent practitioners, GPs and psychiatrists, religious healers, exorcists. Catholic Church tends to use the term exorcism. Anglican Church tends to use the term deliverance ministry. Charismatic churches tend to use the term deliverance. So who would manage such a project? I'm just suggesting to the Ethnic Health Initiative as an organisation the idea that a person within the organisation could be appointed as project management coordinator. But how do we validate the findings? Any research needs to be validated by an accredited scientific institution. And I already have one university in this country that is interested in such a project. I was hoping the professor in charge of that department would be here today. I don't see his face, but he's certainly interested in following it through. I also have a potential postgraduate research student who's interested in taking on the project to analyse the data and write up a thesis on it. So infrastructure is in place. There may be other universities, more local, that may be interested in it. Are there any representatives from any other universities here today? Anyone? No. So apart from the university that I have in mind, it's located in Northampton, we may be able to tempt other more local universities to get interested. And then we need to establish an educational programme to share the results and train for best practice. So you see, it's a long-term idea, long-term project. It's not going to happen overnight. And all research projects require funding, so applications for funding need to be followed. And that, ladies and gentlemen, is my proposal. Thank you.
I'm advised that questions will be taken at the end of the morning session for both presentations. I'm been corrected. We have 10 minutes. Tea and coffee will be available at 11:30. So I will allow questions.
Are there any questions?
I'd like to say thank you for even starting to think about such a research project, because where I work in the southwest in Plymouth, I'm a shaman, so I work in the NHS as a shaman, and when I do, I put a big chair in front of the door so that no consultant would come in, because I would lose my job. It's as simple as that. So, and if I was to talk about my work in the MDT, I would literally be taken for completely. So I think it's so important that these concepts are being researched and spread so that we can talk about what we do, really, as simple as that. So thank you.
Yes.
Sorry, unless anyone else wants to go, because I've already asked the question. Yeah, I echo ladies and sentiments. Thank you very much for your presentation. Yeah, I was glad that you started off by talking about the universality of spirit possession, because I kind of agree that's when the Shashiyulo, I can't remember your name properly, was speaking about the universality of the diagnosis. I was more thinking, well, actually, I'm suggesting that there might not be, there's not having dealt with white patients. I was quite keen that you mentioned that that's really what you have dealt with, because of course there's been a reason why we're not seeing white patients so much, or European patients, because there was a time when Europeans this didn't happen to them, because they went through a period where it was like, this is something else that happened somewhere else. But as part of my PhD, I wrote a novella about spirit possession, being told from the spirits themselves. The spirits are narrating the story. And in that novella, I deliberately put an English character in, because the practice that I researched, an individual can be possessed by any ethnic spirit who are located in Guyana, so historically. So Guyana, English-speaking Guyana has East Indians, Chinese, Portuguese, Dutch, and so on. So at any given moment, and European English, at any given moment, spirits can manifest as one of those entities. So it was very important for me to actually put an English character who, having married an African or black woman in Guyana, goes to one of these rituals where spirit possession or trance possession is practiced, for him to experience trance himself, just to explore that dynamic, to actually show that it's not something that's removed. And actually, if you are culturally, what's the word? You're married to someone from another background, you need to be able to understand the depth of that culture. And in this case, this Englishman's case, he was initially very mindful and very rejecting of his wife's seeming erratic behavior and so on when she was going through her experiences. So I think it's very important that you stress that most of your patients have been white Europeans or white patients.
On the cross-cultural integration, I can speak from experience here. The case I mentioned to you earlier about the woman who was possessed by the North American Indian chief, when I went through the process of releasing him, I became possessed by him myself. So I, as the Indian, went through the process of releasement and reconciliation. Deeply profound experience, took me months and months to get over it and a long time to fully understand it. Similarly, I had a case before I had any knowledge of these things, going back 20 years now, in my early days as an emerging practicing hypnotherapist. I had a young man who came to me, wanted help with developing his self-confidence. He had low self-confidence. And we did some work, and he was about 20 years old, this young fellow. He came out of the trance and he said to me, he said, I just had a really strange sensation. I felt that somebody wanted to speak to you, but it wasn't me. And I thought, well, this is interesting. So with his agreement, he went back into trance. And it's taken me 20 years to have this account published, because it was so difficult for me to believe that I needed to get evidence for its validity. And when I'm going to stand here and tell you what happened now, for 20 years I found it extremely difficult to talk about this because of the spirit that came through. The young man went back into trance to allow this voice to express itself, and he sat bolt upright, he opened his eyes, and as soon as he opened his eyes I could see that it was not him, just by his eyes. And I said, who are you? And this astonished me, and it would astonish anyone I tell with disbelief. The possessing spirit said, my name is Lao Tzu. And if those of you who are familiar with Taoism and the Tao Te Ching will know who Lao Tzu is. At that time I had no idea. I didn't know who this person was. He was very, very wise. So he was a possessing spirit that gave me information that was so profound and so valuable that it took me 20 years to have it published. I published it last year. So the universality of spirit possession can be malevolent and it can be benign. Spiritualists who practice spiritualism and spiritists in South America communicate with spirit guides and can become possessed by those spirit guides that give help and healing and information. So, and I stress this in my book, the science of spirit possession. We are talking at this conference about the negative aspect of spirit possession in ethnic groups, the damage that's done, right? But that is only one small part of the whole concept of spirit possession. It is universal. We're all affected by it, for good or for ill, and we need to have knowledge about it. Yes?
I was interested, you said in your discussion of your clinical work that when you meet somebody, you make a judgment early on about whether this is true possession or part of a mental disorder. I'm just wondering what your step for how to do that is.
Well, this is part of the training, part of the education. To answer the question very, very simply, and there will be people here who can enlarge on this, people who are specialist trainers, the simple answer to the question is you ask. Like I did with the woman who was angry, and I said, who are you? You just ask. What are we dealing with? What's your name? What do you want? That's the first step in the process. Yes?
Sorry, I think it's a really important point. So I'm a lecturer in linguistics, so I study the language used in possession codes. And I think, as a recommendation, I think you have to be very, very careful about teaching people to be possessed. Yeah?
Yes.
And I think that's with the language used. And I noticed in the 2 instances that you gave, in all of my research, where I looked into cases where I can show that people have learned to be possessed, it's through questioning and answering techniques that either a pastor, clergyman, whoever it would be, is actually elicited from possessing. And I think sometimes that focus on determining that you think that there's an alteration in somebody's identity leads you to question them with who are you, which actually you can trace back into the biblical Deuteronomy passage, which is Jesus trying to situate the demoniac linguistically with that type of question. And therefore, I think, as a recommendation, I would say I would be very, very careful in using any type of question that could elicit that type of response in order to determine what you would believe as a true possession, as opposed to something else taking place with your clinical possession.
I agree with what you say 100%. it's a dangerous thing to do, to ask leading questions. You need to be completely open in your questioning, open-minded, and to try to elicit the true nature of what you're dealing with. You can't put ideas into the, because if they're entranced, they're highly suggestible anyway. You've got the dangers of false memory syndrome and everything that implies. So language is very, very important, yes.
But by actually asking somebody who they are when you've already substantiated who they are in a clinical setting, I think that would call into question of identity query. And therefore I would be very careful about using that specifically in any kind of determination of...
I agree. And it's a subject for elaboration and discussion within the domain of clinical practice, techniques and procedures. What I really wanted to talk about today was the idea of establishing an epidemiological survey and to find out whether it's a viable proposition. So just based on what I've said so far, who thinks it's a good idea?
The
research proposal that I've suggested. Who thinks it's a good idea? Okay, so we've got about a third of your hands have gone up. So I thank you for that. Any more questions? No? Okay.
Thank you very much, Dr. Palmer, for a very interesting and a very practical presentation. I like the idea of gathering more knowledge and information about these kinds of issues, and also to provide some kind of a coordinated attempt to respond to it. Just one observation I must make in relation to this Stobart review. Very important review, accessible, published about 6 years ago. But you must remember that the headlines in the newspapers at around that time about split possession as being the main cause of child abuse, and split possession being exclusive to minority ethnic groups. Must remember the Stobart review was a desk review. It was not actually talking to individuals who had the actual experience. Secondly, the report was based on a total of just over, I think, 38 cases reported to Stobart by various agencies. There are about 30,000 children who are taken into care by social services every year. And Stobart review covered a period of 5 or 6 years. I'm not sure precisely how long the period was. So just got to hold that in mind, that because it was not her fault that the media picked up on the notion of split possession, child abuse being intrinsically linked and prevalent in BME communities. Dr. Palmer, very interesting presentation. Thank you very much. We will have a further opportunity for discussion and debate towards the end of the morning session after the next presentation. Now we have a break of